As Maya Angelou once said, a little act of kindness goes a long way. Now you may be wondering, how on earth does that quote relate to this project and sports injuries? Well, how I see this connection is via education. What seems like a small act to educate oneself of the fundamentals of sports injuries and immediate remedies can actually play a crucial role in both you and your loved one's well-being 2 to 10 years down the line. What seems like a simple accumulation of more knowledge can actually save you tremendous years, getting you back to doing the activities you love. So without further ado, in this first episode of our Rhythmo AI video series, we will delve into understanding sports injuries and essential first aids. Whether you're an amateur athlete or a seasoned professional, knowing the types, causes, and immediate remedies of sports injuries is essential for your long-term health and performance. First, let's start off by defining what constitutes a sports injury and categorizing them into their two distinct categories. In essence, sports injuries involve damage to parts of the body due to sports, exercise, or athletic activities. Some of the most common sports injuries include sprains, strains, fractures, and tendinitis. Sprains and strains are prevalent in sports involving rapid movements and high impact, such as basketball, soccer, and gymnastics. Fractures often result from falls or collisions commonly seen in contact sports like football and rugby. Tendinitis, on the other hand, is an overuse injury common in sports that involve repetitive motion. Interestingly, a study from the British Journal of Sports Medicine revealed that up to 30% of athletes in endurance sports suffer from tendinitis due to repetitive stress. This highlights the pressing frequency of the situation and underscores potential gap holes in the recovery process. Now, with the knowledge of the varying types of injuries, knowing how injuries occur is the next step to help in prevention. Often, injuries arise from overuse, trauma, improper technique, and inadequate equipment. Overuse occurs when muscles and joints are repeatedly stressed without adequate rest, leading to conditions like stress, fractures, and tendinitis. Trauma, such as collisions or falls, can cause fractures and dislocations. Using improper technique or poorly fitting equipment increases the risk of injury. Research from the American Academy of Orthopedic Surgeons emphasizes that proper technique and equipment are crucial in preventing injuries. For example, a study published in the Journal of Orthopedic and Sports Physical Therapy found that incorrect running form significantly increases the risk of stress fractures and tendinitis among runners. So, if you've not sort of figured out the pattern already, sports injuries can be broadly classified into two types: acute and chronic. Acute injuries happen suddenly and include sprains, fractures, and dislocations. For instance, a sprain occurs when a ligament is stretched or torn, often from sudden movements or falls. Fractures involve a break in a bone, usually due to high-impact activities or direct impacts. Chronic injuries, on the other hand, develop over time due to repetitive stress on muscles and joints. Tendinitis, for example, is an inflammation of the tendons often seen in sports such as tennis and swimming. Chronic types of injuries can be detrimental to one's lifetime of activity, yet the exponential growth to how prevalent it is becoming is a scary truth to admit to. In fact, according to the American Academy of Orthopedic Surgeons, chronic injuries account for nearly 50% of all sports injuries in middle and high school students. Now that says a lot about the knowledge and emphasis teens possess around sports injuries. Discussing acute and chronic injuries, this vividly reminds me of my ankle sprain from 2019, where I tore 2 out of 3 of my right ankle's lateral collateral ligaments. Initially dismissing the seriousness of the injury, I wasn't aware of the necessary immediate remedies to apply, and I continued to partake in sports. Although my ligament tears were in fact already really severe, continuing my activities in sports simply further overused the surrounding muscles and joints, as well as resulted in re-sprains. What could have stayed as an acute ankle sprain with a shorter recovery period, this repetitive cycle ultimately led me to develop chronic ankle instability, which made me prone to re-tearing and spraining my ankle and ligaments. This unpredictable sports injury recovery experience was also what inspired me to initiate the Rhythmo AI project, as I'm sure I wasn't the only one who went through such experience, and I would like to help more people. A notable example of one who experienced something similar to me is professional soccer player Zlatan Ibrahimovic, who suffered a severe ACL injury in 2017. His injury required surgery and a lengthy rehab period, impacting his career, but most prominently highlighting the importance of proper treatment and recovery. So you may be wondering, How exactly are chronic injuries developed, and what are ways to minimize this? Now, this is where immediate remedies comes in, which I will always 100% stress on so much after what I've personally gone through. The most basic first aid, which suits most sports injuries and what everyone should be knowing with a snap of a finger, is the RICE method: rest, ice, compression, and elevation. In detail, resting the injured area prevents further injury. Applying ice packs reduces swelling and numbs pain. Compression with elastic bandages helps control swelling, and keeping the injured area part elevated above heart level minimizes swelling. According to the American Orthopedic Society for Sports Medicine, the RICE method is effective in speeding up the recovery process. Ice should be applied for 20 minutes every 2 hours during the initial 48 hours post-injury. Compression bandages should be snug but not too tight, and the injured limb should be elevated as much as possible to reduce swelling. Furthermore, a study in the Clinical Journal of Sports Medicine supports the effectiveness of the RICE method in managing acute and ankle sprains, highlighting that immediate application can significantly shorten recovery periods. A notable case study of this involves NFL player Saquon Barkley, who used the RICE method after an ankle sprain, allowing him to return to play sooner than expected. Even so, it should be noted that self-treatment is only appropriate for minor injuries like sprains, strains, and bruises. Minor sprains and strains can be managed with RICE and over-the-counter pain relievers. Bruises can be treated with ice and also sterile bandages, whilst blisters should be cleaned and covered. The Mayo Clinic advises that self-treatment is suitable for minor injuries, but emphasizes the importance of seeking medical advice if symptoms persist or worsen. For instance, a mild muscle strain can often be managed with rest and may require professional with rest and anti-inflammatory medications, while a more severe strain may require professional evaluation and physical therapy. Thus, it is crucial to be able to differentiate between the two severities of the injuries and always be observant of how your body is feeling. Therefore, early intervention is crucial in the sense that addressing injuries immediately can prevent chronic issues, reduce recovery time, and improve overall outcomes. Research from the American Journal of Sports Injury indicates that early treatment of injuries leads to better long-term results and lower recurrence rates. Alternatively, ignoring and delaying treatment can lead to complications and prolonged recovery periods. For example, early intervention in cases of Achilles tendonitis can prevent the development of chronic tendonitis, which is much harder to treat and require a longer recovery period. Overall, knowing the different types, causes, and immediate treatments of sports injuries is essential for effective management and prevention. In our next video, we'll explore the serious consequences of delayed diagnosis and effective ways to self-identify injuries early on. I hope you've learned something new to take away from this video. Thank you for watching and stay tuned!